Dr. Gabriel Catalina. I'm an internal medicine physician and I work at Seacrest Rehabilitation Center. I have a special interest in orthopedic injury and recovery, and I've been asked to talk to you today a little bit about pickleball safety. So let's get started. First thing I want to talk about is proper stretching. It's very, very important that you stretch prior to playing pickleball. Probably the most common injuries that people suffer are muscular injuries to the lumbar spine, the quadriceps, the groin, the hamstrings, the calves, and the Achilles tendon. I recommend, if you're not understanding proper stretching, that you consider consulting with a healthcare provider so that you understand the proper way to stretch. This should probably take you 10 or 15 minutes to stretch and warm up prior to engaging in pickleball. The second thing I'd like to focus on is proper footwear. It's very important that you have shoes that are cross-trainer type sneakers that are supportive to the arch, to the heel, and to the ankle. A lot of times in older patients, they have foot problems, and in those cases I recommend that you consult with a podiatrist to consider orthotic inserts, which will help support the foot better. Also, people a lot of times have issues like weakness of the joints, or they have arthritis, so braces to the knees, ankles, elbow, or what have you also are helpful in supporting proper muscle and joint function when you play pickleball. The third thing I like to focus on, this is probably something I should have said first, consider a pickleball learning class or a clinic. When you're there, you learn a lot about technique, proper spacing with your partner, proper stroke mechanics, proper footwork, how to communicate with your partner so you don't cause collisions. So a pickleball clinic will give you a lot of the basic information that you need prior to starting, and in the long run, hopefully help you avoid injury. Another important fact that clinics a lot of times will tell you is about court awareness. As you can see behind me, there's more than one court here, so you're playing on one court, there's players on another court. More than likely an errant ball is going to come into your court, so you have to be aware around your feet. You want to be stepping on errant balls and turning your ankles. So that's also an important point that's usually brought out in pickleball clinic if you've never played before. The next thing I probably think we should talk about is limitations. A lot of times you see older patients who want to play pickleball and they think they're still 20 years old. And what ends up happening is they think, oh, I can dive for this ball, or I can stretch for this ball, or I can make a back pedal for this ball. And all of those things are potentially going to put you at risk for significant injury. Backpedaling, you can trip back on your feet, fall back, hit your head. When you're turning side to side, you can turn an ankle, you can rupture an Achilles tendon. So it's important, again, to have special and appropriate body mechanics so that you can avoid these type of injuries. And injuries I've seen over these last few years with pickleball, injuries to the head and neck from falls, concussions to fractured necks. You can have shoulder and back injuries. Probably the biggest is going to be knee and hip injuries, torn ligaments, sprains, strains, and unfortunately even hip fractures. So it's very, very important to try to be safe along with it. How do we avoid injury? That's a question people always want to know. How can I avoid this injury? Well, the first thing probably I recommend, people don't realize that pickleball, it's an exercise in and of itself. However, you want to have proper body strengthening prior to playing pickleball, because you can strain your muscles a lot easier if you're not in good shape when you start. So I recommend strengthening muscles of the upper extremities, the core, the lower extremities. This way you have better body positioning, better body control. Also, again, consider Pickleball Clinic, as they can teach you the proper spacing and techniques, so it's always a good idea. And I'd be remiss if I didn't mention hydration. Hydration is super important, especially in older patients. Older patients a lot of times are on blood pressure medications, they're on diuretics. These things can increase the risk of dehydration and low blood pressure. So hydrating prior to, during, and after pickleball is very, very important and recommended. So in summary, pickleball is a great sport. It's probably the fastest growing sport in America, and we want to do it safely. So I want to recommend stretching and warming up. That should take you about 15 minutes. Thinking about doing Pickleball Clinic so that you understand proper technique and spacing, and also proper footwear to prevent injury. Thank you very much for listening.
To learn more about Seacrest Rehab, visit www.seacrestrehabhc.com.